All right, let's go ahead and get started with our land acknowledgement then. We have a quorum. We have enough of us here that we can make decisions.
Okay.
That will be official.
Thank you. All right, so we recognize and acknowledge the indigenous, I can't read today, indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yukiskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be guest, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Gracias, Mayra. Thank you. Okay, I don't know if I think, do we have anybody new? We don't really have anybody new. It hasn't been in our meetings before. So let's go ahead and go on to introductions of CAC members. And Kelly, do you want to help bounce us around?
I will. Brad, can we start with you?
Sure. Brad Porterfield, consumer rep, CAC, the chair of the Community Advisory Council, and also director of Latino Community Association.
Next, let's do Elizabeth and then Connor. Oh, she was here.
Connor Carlson, CAC member and partner with the Family Resource Center of Central Oregon.
Elaine, then Karen.
I'm eating lunch. Elaine, Facebook community CAC member, Mosaic.
Karen.
Hi, I'm Karen. I'm with Jefferson County Public Health, Health Equity and Education Specialist.
Mandy, then Maida.
Hi everyone, Mandy Seeley. I use she, they pronouns, and I am a CAC consumer rep out of Sisters.
Hi everybody, Maida Benitez, consumer rep, also family resource community member, and I am in Madras.
Stacy, then Miranda.
Hi, Stacy Shaw, she, hers, consumer rep in Crook County Health Department rep.
Good afternoon, everyone. Miranda Hill here. I am a CAC member for representing Klamath County.
And Elizabeth, she popped back on. Elizabeth, could you introduce yourself?
Hi, I'm Elizabeth Schmidt. I'm the vice chair. I've had terrible trouble the last couple of meetings signing on. So I finally got, it kept clicking off and on, but I'm here. Thank you.
Thanks, Elizabeth. Did I miss any CAC members? I think I got everybody. Okay.
Okay, just to remind everybody, we decided there's one small way that we could save a little bit of time, since we always run short of time in our meetings, is to only introduce CAC members and then anybody else who's a guest or new to our group. So that's the reason we're not having everybody introduce themselves. And I think everybody here we've all seen before. So welcome to everybody else, including CAC, Health Council staff and everybody from OHA and Pacific Source. Let's move on to public comment. Is there anybody who'd like to make public comment?
I would.
Go for it, Mandy.
I just want to give a huge shout out to Kristen. For anyone who was at the joint meeting last week, it may have seemed like we were chit-chatting to avoid the fascinating financial conversation that was going on. However, we were working together to help a consumer here in Sisters, and I ran into her yesterday, and she's just incredibly grateful, and Kristen always goes above and beyond and answers all of my random questions that I email her with. So just wanted to say thank you, Kristen. Sorry to embarrass you.
No, I'm so glad to hear that she got some of the help she needs, because yeah, that was a tricky one. So yeah, thank you. That's really nice.
Thanks, Mandy, and thank you, Kristen. Is there any other public comment? Is now an okay time to ask? I think, Kristen, you were going to follow up on one of on the public comment from our last meeting that Kimberly Rojas shared about language access and some other things at St. Charles. Are you ready for that? Or do you want to kick that over to February?
You know what? I'm sorry. I'm not ready for that yet. I was going to pull like grievance and appeal information, but I can have that available in February with the grievance and appeal information. And I think it actually speaks to, Brad, to your question about like the provider search and the provider directory and things like that, that I plan to talk about a little bit later in the meeting. But I will have the GNA and the language access information available in February.
Okay, thank you.
And I am going to follow up on the eyeglasses question too, but they have time for me to do that at the end of the meeting as well.
Okay, so that'll be today, the end of today's meeting? Yeah. Perfect. Thanks, Kristen. All right. Well, one more last call for public comment.
Oh, me, sorry.
Right, go for it.
The unmute button quickly. Scheduling dental appointments for kiddos, it is extremely long. I called in for my son and we don't have an appointment until May.
Wow.
Yeah. And
can you tell me which dental care organization that appointment is scheduled with? Advantage or
Advantage
Capital?
Advantage Dental.
And which location or all locations?
Well, at this point, I asked for any location when she gave me the May date, just because he's got a bridge in there that needs to be taken out because his tooth is coming in and bothering him. And she said there isn't anything soon enough. They can put him on a cancellation list. If anybody cancels, they will move him up. But that's kind of where we're at. We'd have to wait until May.
So all offices, just to clarify that, okay, that was the soonest available. Okay, thank you. And I'm sorry, one more clarifying question. Were they established as a patient with a dentist before?
Yes.
Okay, that's good to know. Thank you.
Sorry to hear that, Myra. I had a similar experience with my son in Redmond. Not quite as long, but I think it was about 3 months.
You know, it's not the public cleanings because those are usually like every 6 months. So once he gets a cleaning, he gets scheduled for the next one, but it's anything kind of like urgent or, you know, that comes up aside from cleanings.
Yeah. All right. Okay, well, let's move on to our notes from December. Is there anybody, hopefully y'all had a chance to look those over. They're pretty short this time around. And just I'll ask if there's any questions anybody has, anything you see that's not quite right. Anything you'd like to see changed or added? Okay. Then if we'll just do it like we've been doing it, if there's no problems with the notes from December, we'll go ahead and say that they are accurate. They accurately represent our meeting. And we'll move on. So to our breakout sessions.
Okay, sorry about that. Today's Question, or not really question, just a discussion topic, New Year's resolutions. What are your thoughts? Yes or no? Is anybody still sticking with their with their resolution for the year? And I have you in your breakout rooms, and we'll see you in just a bit.
Well, that was fun as usual. All right, we are gonna move on to our kind of debrief of our combined meeting. And one thing I want to do real quick is we didn't have very good turnout from our CAC members. So I'm curious to get some feedback first on that. Like, was there miscommunication? Did it just not work with your schedule? And it's not to shame anybody. It's just curious because I think there were only 4 or 5 CAC members, if I'm not mistaken, at this combined meeting with the board of directors. So anybody want to share? Just to get some
Yeah,
feedback.
I can share. I wasn't able to go, it just didn't work with my schedule at the time. And even though I realized I hit denied really quick, not realizing it was going to take the invite out of my calendar because I couldn't be there personally because of the travel. I would be losing, 2 work hours for traveling, but I could have joined virtually for at least a bit. But then I didn't realize like the day of like, oh, it's already gone out of my calendar.
Thanks, Maya.
But it was actually just an in-person meeting, so there was no
Oh,
to join.
okay. So
No worries.
perfect.
That's also good feedback.
Yeah, and it makes me think of if it would be better to have in Redmond. So people from Manchester wouldn't have to go a full hour.
Yeah, that would definitely work. Meet halfway.
Yeah, my issue too was my daughter had gotten sick that day, so I had to stay at home and so I wasn't able to attend. But I had already had like the transportation and even help with baby because usually Ezra comes with me everywhere I go, because he's 7 months. But if she hadn't gotten sick, I would have been. So sorry about that.
I hope your daughter's feeling better.
She is. She managed to pass it on to me, but I'm doing good now.
I saw Mandy. I saw your comment. You were there, but I saw your comment thanks for your comment in the chat. You had to leave early because it did. Yeah, our timing got a little off as far as the way the meeting ran, but thanks to everybody who was able to make it and those of you who tried and couldn't. And at the same time, I also want to highlight how great participation has been at all of our CAC meetings, including this one. So thank you. And I'll start with a debrief, and then I would ask the others who were there to pitch in. Mandy alluded to earlier that there was a lot of talk about finances, and that's very true. So we had the board meeting first, and I think almost everybody was there for that. And then we started the combined meeting afterwards. And even at the combined meeting, there was still a lot of talk about finances, as I recall. That's not that that's not important. It was important. It was interesting, although also kind of confusing. But it brought to light for me that not only CAC members but board members need education, for lack of a better word, about how to look at the the budget and the finances of the Health Council, because it is kind of confusing. It's not typical, even if you're used to looking at like nonprofit budgets or public health budgets, or maybe, I don't know what a public health budget looks like. Maybe it's more like that, but it's not like a nonprofit budget, at least not like our nonprofit budget. So that was interesting. And then we talked a little bit about, we spent some time talking about, letting the board know that we had done a little work on advocacy, the letters that we put together on the CAC to the different decision-making bodies in the health field around, those letters were around workforce diversity and just addressing the issue that we think providers need to get more than 35% of the cost to provide a service if we're ever going to get more providers to serve OHP families, consumers. So those are the two issues that I recall. And so we shared that with the board members. And I think just only other thing I have to add is we just kind of reminded all of us together that it's, our connection to the board, or our service to the board, is to voice consumer issues, positive, negative, but basically to help provide a voice of Oregon Health Plan consumers so that the board can do its job. Essentially let the board know if there's anything that's not working, if there's things that are working, and what can the board do about it, and or what can the CAC do about it, or what can we do together. So I'll stop there. Anybody else want to add kind of your impressions?
Well, I have a comment. Carmen educated the board about well, what was that? That money, that free grant, and the application for it. And they were fighting about, they wanted more information, and she was saying, look, we're gonna lose it. It's a lot of money. How much was it? Like millions or something? And anyway, with her experience with grants, I was impressed with Carmen's presentation. And she didn't let the board bully her, which they almost seemed like they were about putting off that application. And boy, she just came around. She was very assertive. I was very impressed. So that's my comment.
Elizabeth, I'm
Elizabeth.
driving right now. Can you all hear me?
Yes, we can, Carmen.
Okay, well, thank you. I appreciate that. I feel that I was doing my job. So garnering more funding for the community at large. I do believe, though, that anytime that something is new, something that looks different, there were questions, and that's really what happened around that. But I was excited towards the end that there was full board support to continue with the application. So we're excited to see where that heads us. Stay tuned.
Well, my comment is, I think you have a lot more experience with the big grants than Donna had. And Donna did an excellent job, but I just really appreciated your comments. So, and I told Linda that as I was leaving. Yeah. So,
thank you, Elizabeth.
Thanks, Elizabeth.
Sure.
Yeah, thanks, Elizabeth. Anybody else want to pitch in what you remember, your perceptions?
I mean, for me, it was just kind of, I don't think we caught them at their best meeting. It seemed like a pretty heavy meeting to be a part of, and it was interesting to just observe and see how they navigate to, budget. Anybody talking about money is always going to be a tough subject. So if anything, it makes me want to go to more. So I'm optimistic.
Well, that's definitely a positive outcome. That's good. Mandy, I know I saw you're in the chat. You shared some things. Do you want to speak to that, or are you just happy leaving it in the chat there?
No, I can, because I see
Okay.
Carmen's driving, so she probably can't see the chat.
Sure.
I just mentioned that I had a great chat with Justin before I left about Summit and Sisters and their goals. I hadn't even realized, which is silly, that Summit had taken over for BMC, and they're right on the main strip. So it was nice to talk to him and see what they are looking into. And on that financial piece, because I was still there for that. As much as I didn't really know the level of what they were talking about, I really did appreciate Justin's persistence to not want to, agree to something that wasn't clear for him and his expertise. So it was just an interesting experience to watch all of that play out and the questions that came up and the conversation that they had around that particular financial piece. And like Stacy, it would be interesting to listen to other ones and see where that conversation goes in the future whenever the two Justins are able to connect on that.
Thanks, Mandy. Linda, you've joined us. Do you want to introduce yourself, and then do you have any perceptions to share about the combined meeting?
Sure. Let me get off camera too. Linda Johnson, community member, also on the Health Council board. I think the meeting ended up in a good place. I think it was an example of sometimes where you think you're going, you find out there are deeper issues underneath that you hadn't understood. And you're on the public stage and you're trying to figure out how to manage that gracefully. And sometimes that works and sometimes it's awkward and clunky. The other observation for me was I've been on the CAC now, I think when did you come on, Brad? 4 years ago?
I don't remember, to be honest.
So I think I was on the CAC a year before that. And to see the level of participation and questions and active participation in the conversation by CAC members really helped me to see how much we've all grown in the last year, and how with the focus on building relationships, it was the first time I can remember that people on the CAC that were present really felt comfortable speaking what they wanted. And I think that's really what we've been working on, is trying to develop a relationship as equals. And so I could see that from both sides, that CAC members are being listened to and appreciated for their input. And I just felt great about the dialogue, even though it seemed clunky at times.
Thanks, Linda. Yeah, one other thing that I'm just realizing now as I look at my folder is, I don't know if we can bring this up, but this document was shared, which is a list of legislation that is currently being considered by the Oregon legislature. So, and health related, it's kind of broken up by like housing, health, behavioral health. That's kind of it, housing, behavioral health, and other areas of health and human services. And I don't know if I knew this before, but Tom, who's on the CAC who works at the Deschutes County Health Department, that's kind of his area of focus. I don't think I knew that before. Tom Kuhn is focused on legislative issues specific to health for the health department in Deschutes County. So I think he's somebody we can perhaps lean on to kind of keep us up to date on these things. So if you have any, we'll make sure that everybody, I don't know, did everybody get this? Health Council staff or everybody who's here, did you get this in your combined meeting packet?
Yeah, it wasn't included in our meeting packet for the combined meeting, but I will send it out to everybody right now.
Okay, thanks, Kelly. So I think we'll give one more last call for anything anybody would like to share about the combined meeting.
I was going to drop an article into the chat if anybody's interested in, they call it Village Health. That's the Walgreens health side, I guess, or their they're calling it comprehensive care side. But I will drop a KTVZ article in the chat if anybody's interested. I would just note that Justin spoke pretty positively of the I want to say partnership, because I think Summit Health is still a owner in this. So yeah, but I guess we'll see what happens. But there is more information in that article.
Thanks, Kristen. Yeah, Justin certainly seems optimistic about, I guess, their approach, but yeah, we'll see. Anybody else? Okay, yeah, the one thing, I'll just say one more thing on it, that remains really crystal clear to me, and maybe I think we're gonna, maybe we take the last few minutes to talk about, future combined meetings with the board. It seems to me that it just gets clear and clear to me that anything we can do to bring more consumer voice to the board at those combined meetings, that would be the most productive way to spend time together. Kind of sharing, maybe it's having a discussion around our emerging issues, which Gwen's gonna go over next. Maybe that's the focus of our discussion, so that they're clear on all the issues that we're looking at, and we can actually have conversations around that. Or we decide to bring one issue to the board that we just think is like, seems to be rising above all the other issues as something that maybe the board can tackle or have an impact on, or we can start to work on together. So I want to open it up to get your ideas on that. And again, this is how should we spend our time together with the board at our future combined meetings? What would you like to see the outcomes be, the discussions be about? I'm going to call on people who haven't spoken up much yet, and then I'll go to you, Linda. Connor, do you have anything you want to share, or Karen? It's okay if you don't.
I don't have anything at this time. No, Brad, thanks.
Okay. Karen? And questions are okay too.
I don't have anything at this time either.
Okay. Go ahead, Linda.
I was just going to say another thought that came to me earlier this week when I was in a meeting with Carmen and the staff to do sort of a debrief of the retreat, was it reminded me that as we work to build a better relationship and to get more effective at making sure that the CAC's perspective and voice is more woven into the considerations and decisions that the board makes, it's that analogy of building the airplane as you're flying. And we haven't done this before. It's sort of a new and emerging thing. And so I just say that, it's okay if we don't have ideas about how to do it better, because it's new. We're trying to create this airplane as it's flying, and that's okay. And just to have some grace with each other, that we're all trying to figure it out together, and it may be awkward, but that's okay.
Thanks, Linda. Stacy, your hand's up.
I think just after the last meeting and the hopes for the future, kind of going off what Linda said, was really being how do you say it? Being cautious, and also making sure that your own interpretations or participation in that combined meeting is efficient, like making sure that we're not kind of like them and us, going at it as we're all part of this community and we're all working towards that ultimate community health goal, and kind of leaving behind that they're the board of directors, we're the CAC, they're this, they're, you know, just going at it as being as open and understanding, but also not saying like, oh, just, you know, let whatever happen. But I don't know how to say what I'm trying to say. It's been a long morning.
So one thing I heard you say is, I think I heard you say is to avoiding the them and us dynamic. Like really trying to have conversations that are, it's like, it's us, an us conversation. Like what can we do if we bring a consumer issue to them? You know, what can we do together to make a difference on this issue? Is that kind of what you're getting at?
Yeah, and the way I see it is, you know, a lot of people in their position, yeah, they have a lot of power, they have a lot of experience and all these other things, but at some point they had to decide in their life that they wanted to reach that goal. And so the way I see it is all of those board of directors probably started out at the community level, trying to advocate, trying to do something for the community, and worked really hard to get where they're at to be able to do something. And so, you know, there is no them and us, it's just all of us trying to do something for our community. And I think sometimes we lose sight of that. And then you add in different lenses and communication styles, and we're just all clashing. Because, I mean, I saw that at the board meeting where everybody was saying the exact same thing in a different way. And it just was like this loop. And then I was just thinking, like, you guys are all saying the same thing for 30 minutes. But it's that just form of communication and understanding and having that trust that we all want the same thing, you know? So that's kind of what I got from it.
Thanks, Stacy. Okay, last call for any other input, questions, ideas, just observation
I have one thing.
on this topic. Go ahead, Mandy.
So at another job that I was at a few years ago, we did a board and staff retreat that was super informal. We all just got together at, you know, a separate location from work. And just talked about like, here's why I joined the board. Here's why I wanted to work here. And just exactly what Stacy is saying, basically, but like maybe another way to get there, and maybe the board and CAC can do something like that, just to build relationships and stuff. And I know it gave me a different perspective of everyone that was there moving forward and how we were all a team working towards the same goal for our community. So just a thought.
I really like that idea. So that's, if I could restate it or just see if I understood right. So basically at the next, perhaps the next combined meeting, we would kind of have an icebreaker or just an opening in terms of building relationships, just asking everybody why they're there. Why are they doing this work? Is that kind of what you're saying? Suggesting?
Kind of, but this was like a separate thing where we weren't making decisions. It wasn't a meeting. It was just an informal get together where we were getting to know each other. It wasn't like specific to work relations, and we were there to make decisions or anything, or do work or anything like that. It was strictly getting to know each other.
Okay.
Like no introducing titles and just our first names. No introducing titles retreat. There we go. That'll be the.
I'm hearing a party that's about to happen here in the next months. Social event.
Sounds good. All right, thanks everybody. We're gonna go ahead and move on to Gwen and our emerging issues follow-up.
So I'll jump in. I'm going to have Michaela chime in. So quick update on the emerging issues. So the letters that you all drafted went to the HERC, the review committee, health equity, the HERC up at OHA. The ones that you drafted a month or so ago with regards to just elevating the issue of reimbursement rates and workforce development. I recently heard back and got information on how to submit those to the Medicaid Advisory Committee. So that will be the next step. And then we'll go from there with just the information sharing. And then the other piece that you all identified last meeting as a next or an additional item that you'd like to dive into was around the non-emergency transport. And so we'll be working with folks to bring a little bit more information to you. And our question for you would just be informally to get started, what would be some information or additional information that would be helpful for you to know about the non-emergency transport issues that you've heard about recently? So that'll just give us some scope of questions to ask to bring information back for you. So what would you like to know about non-emergency transport issues?
I'd love to know, just first starting big picture, like how many rides are given for the non-emergency transport in general under the CCO, and then average wait time, those types of things, average distance, and driver training, driver longevity in their work, things like that.
Like retention.
The pain and puncture.
Hey, Elaine, can you be more specific about wait time? Are you talking about to call and make a ride, schedule a ride, or wait time to be picked up after an appointment, before appointment? Hopefully that's scheduled.
Yeah, hopefully before. Yeah, but yes, wait time to get actually a ride confirmed, and then wait time. I hear a lot from our patients about how long they have to wait after their appointment is done for someone to come. So yes, that too, most importantly.
Thank you.
Stacy's got her hand up. Go ahead, Stacy.
Building on the driver training, I've heard quite a bit of feedback just from like the community on like LGBTQ plus and the like discrimination or just some of the ill behavior towards some of the people using that service. So I'm just curious what kind of training the drivers have, and just for overall safety of people using that service. Do the drivers have to have, certain background checks too? Just kind of that broad.
So driving skill as well as client service level and diversity of clientele.
For us, it's mostly like also trying to find a way where people can access the bus route a little bit more easier. I know sometimes there's families that, there's a language barrier or they're not tech savvy. So I think things like that, it would be helpful for us to know so we can also give out, especially because with us being so close to the hospital, we do have a bus stop here, but oftentimes we'll have people waiting here because they're not sure, or we'll try and help them in the front office, in the front desk, if we can, try and figure out when the next bus is going to come because they don't have the access for it. So definitely reaching for some more help on that would be great.
That's great, Karen. So I'm hearing a few things. It's access to calling in and knowing that it exists, how they can get at it, language, both translation and interpretation services to order services or provide feedback around services. Just to name a few. So.
And Gwen, I've got a comment. I'm curious because I just happened to go looking for a refrigerator for our new Latino Community Association office in Redmond on Facebook Marketplace is where I found it. I ended up going to the guy's house in Redmond, and it turns out it's a family business called CATS Transport. It stands for Chris Abbott Transportation Service. So it's a local family-owned transportation service. I'm just wondering, is Pacific Source, the CCO, like, are they able to contract with local providers like them? Or are there barriers to that? I'm just curious about kind of how that all works.
The contracting process.
Yeah, and he specifically mentioned that they do medical transport, people with diabetes, and so they do provide that service. I just don't know if they are able to do that for the CCO or if there's barriers to that.
I second that question because we have a transportation service in Sisters too. So it would be nice to use a local organization.
Kristen, isn't that part of the Flex Services program?
Not for medical transportation. Non-emergency medical transportation is a covered benefit. So we work with Motive Care, who is the brokerage that handles non-emergency medical transportation for all OHP members in Central Oregon now. Because Cascade East Ride Center that used to handle medical transportation no longer holds the contract for the open card members, so people not assigned to the CCO. And so, yeah, so flexible services could handle other types of transportation needs, like if maybe somebody needed a gas card to go get groceries or things like that, other types of, or to go to a activity, like maybe their kiddo does baseball or something and there was travel involved, things like that, flexible services could help with. But if it's for medical transportation, that's a covered benefit, so it would go through Motive Care.
So Kristen, do you know, does Motive Care then reach out, because they're not local, right? Do they reach out to these local transportation companies and they end up
I'll have
actually
to ask. I'll have to ask the provider service representative who works with Motive Care and I'll ask her if she has like a list of contracted, I guess, transportation providers in Central Oregon. I actually was at COIC Central Oregon. Oh gosh, Brad, what is it? Tammy Bainey's
Intergovernmental Council.
Thank you. I always forget the I. I was actually at the meeting that they held in February of 2020 as the contract was moving from CERC to Logisticare at the time, and then they changed their name to Motive Care shortly after. And there were local cab companies, owners at the table at that time. And so my hope is that they continue to hold a contract with Motive Care. But again, I'll ask Elizabeth, who's the provider service representative, if we have like a list that we could look at and then see if there's anything missing or see if there's agencies that are missing.
Thanks, Kristen.
So lots of quite great questions. Any others that come up that would be helpful for the orienting to this issue and need? All right, well, stay tuned. This will probably come back in a couple of months because next month we are holding a lot of time for reviewing the community health projects process. So we'll be back with more. Stay tuned. Continue the discussion. And with that, I will hand it back to I think perhaps hand it to Kristen.
Hey. Mandy, I just responded quickly, yes. But you might need to reach out to me for more details. She just sent me a private message. Okay, let me really quickly just put my do not disturb on my Skype here. We're ahead of schedule. I can't believe it. Okay. So, and I apologize. My computer can do share screen and audio, but not camera at the same time. It's acting up today. So I did want to follow up on the public comment that came up several months ago about getting glasses. So it was a comment about Central Oregon Eye Care specific to the Prineville Clinic, but it sounds like this problem was happening across all of their locations. So Mariah, who is a provider service representative assigned to them, reached out and heard back from, let's see, what was her name? Brooke, who's the practice administrator. And she had mentioned that in 2021, they had a large amount of frames that were discontinued after the orders had been placed with the lab, which is called Sweep Lab. So then they had to reach out to all of the patients who had ordered discontinued frames to come back in and select a new one. So that was sort of a challenge that she could quickly identify that happened in 2021. Another issue that happened in 2020 and 2021 were, of course, COVID and staffing shortages, and then the supply chain issues. Let me see, I'm just looking through her email here. Another thing to note is that Sweep Lab is the lab that makes glasses for all OHP members in the state. And Central Oregon Eye Care does have another lab that they use for all of their other glasses. And they have a quicker turnaround and 1-day shipping compared to Sweep Lab that uses standard USPS shipping. That can add 7 to 10 days, it said, sometimes to orders. But with that being said, in 2022, things have been better and they've been able to be closer to a 3 to 4 week turnaround on getting glasses made and to members.
Hey, Myra, where'd she go?
I am here.
Oh,
Sorry.
you're there. Did you want to, I saw you talking, but you're.
Sorry, I had a call. And
Oh,
I
okay.
put this on pause. But yeah, sorry, I was just taking a quick call.
Were you able to hear what Kristen was sharing or no?
No, I didn't. I missed like 2
Okay.
minutes of it.
Oh, shoot. Okay. So I'll try to really quickly recap. So in 2021, Central Oregon Eye Care had a bunch of frames that were discontinued. So then they had to reach out to patients to come back in to select new frames. And it sounds like that was sort of an unexpected thing that caused delays of a few months in some situations. She had also noted that Sweep Lab, they make all of the glasses for OHP members, and Central Oregon Eye Care has their own lab that they would use to make glasses for commercial or any other person coming in to have glasses made. And Sweep Lab has longer shipping times because they use USPS, and the other lab does overnight shipping or 1-day shipping.
Okay.
And so the positive thing is in 2022, they've been able to get glasses in about 3 to 4 weeks. So they're hopeful that like supply chain issues and staffing issues are settling down some. So it seems like 2022 is just getting a little bit better than 2020 and 2021 as far as getting patients seen and glasses made.
Okay. Thank you for that.
You're welcome. Did anybody have, I know Mandy, you had also commented that there maybe were some delays in Sisters. Did that seem to be a reasonable explanation for why there may have been some delays?
Yeah, sure.
Okay.
Thank you.
Kristen, was there any sense of what they foresee for the future with the wait time? It's obvious, it sounds like it's getting better. Do they think it's going to hold steady here, or there's other things on the horizon that may impact it in, you know, in one direction or another? And that may not have been part of the conversation. I'm just curious, you know.
You know, she didn't really try, or she didn't really say, but she said 2020 and 2021 were tough years for our practice to try to maintain the level of customer service they strive for with COVID and staffing shortages. And then they had like the supply chain issues as well. And, you know, to be honest with you, I don't know what the supply chain issues could look like with the recent surge in COVID in China and other places that do a lot of manufacturing. It's definitely something that I think about from time to time, where stuff is made and what that might look like in the future. But at this time, it seems like in early 2022, they were able to sort of correct course, and they were getting those glasses turned around in 3 to 4 weeks, which is sort of the time frame that they're trying to meet. I could ask Mariah if there's like a, you know, we expect it to be done in this amount of time, but I didn't see anything where it's like, you know, if it's more than 4 weeks, you're, you know, in violation of this agreement or whatever. But if we want that information, I am happy to ask.
Hey, Kristen, I'm curious because I feel like I'm hearing a pattern. Like there's a pattern where, I mean, correct me if I'm wrong, but where OHA contracts with a single either broker or provider. And I'm guessing that's for efficiency reasons, but at the same time, it seems like there's problems with that as well, like lack of competition and other things. But, you know, first of all, I guess, is that true? And then second of all, would it not be possible for them to contract with somebody in like each region of Oregon, 4 or 5 different providers?
Well, we have, just to clarify, we have more than one vision provider in Central Oregon. It's the one lab making the glasses. But I can ask if it's just one lab making glasses for Central Oregon Eye Care OHP members, or if it's all OHP members across the state. To be honest with you, I might have said all OHP, but I don't 100% know that. So it might just be all of their OHP members that they contract with that lab. But I will ask if Sweep Lab, which is the name that they gave, does the frames and glasses for all OHP across the state, or if it's only Pacific Source OHP. There could be some other variables there, but we do have more than one vision provider in Central Oregon. It's not just Central Oregon Eye Care. That just happened to be where Myra went, where the issue arose.
Okay, thanks.
But I can ask about just the lab and clarify with Mariah if they're the only ones making glasses across the state for every OHP member that needs them.
Okay. I think, is there any other comments on that issue? And Kristen, you have more to speak about, right? Beyond the eyeglass issue?
Yes.
Okay.
Sorry, I was just finishing my note there, so I don't forget. I do. So I'm going to share wait, there's a chat. Oh, okay. I'm going to share my screen and sound. Okay. Can you guys still hear me? And can you see my screen, which should be our new website?
Yes, I think we all
Awesome.
can see heads nodding.
Okay, cool. All right, so Pacific Source Community Solutions. Well, Pacific Source has 3 different lines of business. We have a commercial plan, a Medicare Advantage plan, and then Community Solutions, which is the community care organization administering OHP benefits. So we recently launched a new website, and this is it. This is the landing page. And so I just wanted to sort of give you guys a quick tour and show you sort of what's new. It's, I hope, much more user-friendly than the last website. But I thought we would just sort of take a quick tour. And then if there's additional information you guys would like to know, I can bring one of our sort of IT subject matter experts to a future CAC member to do even like a demo in a member only feature that we'll talk about a little bit. So as you guys can see, this landing page, there's getting started as a new member. Oh, up at the top, you can translate the website into Spanish. I don't speak or read Spanish. I would have to defer to somebody else who does. So tell me if it's correct, but I did want to point that out, that there's a button at the top there that would translate into Spanish. But I'm going to go back to English so I can actually navigate. So I was going to just show this quick video here. It's just over 2 minutes. I already made a note that on the Spanish site, it still plays in English. So I need to ask if we're getting that video translated. Maybe it's been linked incorrectly, but I will play the English version.
Hey, Kristen, real quick.
Oh, yes, sorry. Yes.
I apologize for interrupting there, but I just want to let you know that Miguel was shaking his head. There's problems with that very first
Oh.
landing page in the Spanish.
Oh, Miguel, maybe we should chat
So let your team know.
after offline. Yeah, that's good to know, and unfortunately not super surprising. So any feedback I would love to pass along to our marketing team, which is kind of overseeing now the website. So any feedback, I'm happy. We also found that the links to the Oregon Health Authority's grievance and appeals page, those links had changed since when they built that page of this website. So those were all updated last week. So I'm sure we'll continue to find things that are not correct, unfortunately. But here is the Welcome to Pacific Source Community Solutions video.
Community Solutions. We are a coordinated care organization. We give you and other Oregon Health Plan members in your community access to a group of healthcare providers and services. As a member, you might have questions. You may want to know who your primary care provider is, what benefits are covered, and how to get started. You'll get 2 ID cards in the mail. Keep your Oregon Health Plan card in a safe place, and your Pacific Source Community Solutions ID card or your Health Share of Oregon ID card with you at all times. This card shows you who your primary care provider is. They're your main doctor and the one you should contact first when you have a health question or concern. Show this card to your healthcare providers and pharmacies to let them know you have health insurance. Seeing your doctor regularly, even when you aren't sick, can help you stay healthy. That's why members are covered for regular checkups, prescriptions, and other benefits like dental, vision, and mental health. We can also assist you with interpretation, translation, transportation, mobile phone service, and basic needs like food, housing, and utilities. There are even special benefits if you're pregnant or have children. Please visit your member portal, In Touch, to see which benefits your plan covers. If you have questions about this information or your plan, we're here for you. You can email us at communitysolutions.cs@pacificsource.com or call 1-800-431-4135. We accept all relay calls. You can also visit us online at pacificsource.com/Medicaid. Thank you for being a Pacific Source member. We look forward to supporting your health and wellness journey.
Okay. And Miguel, I had to kind of laugh and I made a note that that is translated incorrectly on our landing page. So I'll follow up with marketing on that.
And this is Linda. When people are watching the video, do they have access to a stop or a hold or a pause button so they can write down the contact information?
They
'Cause
do.
that went through very quickly.
Yes, you can pause the video, rewind it. Yeah, you can toggle through here and pause.
Great.
Yeah. And all of this information is hopefully other places as well. If people didn't watch the video, but just before I move on, just to clarify, in Spanish from Spain. Oh, I think it's the correct word. Okay. Okay, Miguel. Thank you for that. So I did also want to note when they were showing the copies of the member ID card, you might have noticed the bottom right corner said health share. We've had some people ask what that's about, and Pacific Source does have a small CCO membership, so a small amount of Oregon Health Plan members in the Portland metro area in partnership with Legacy Health and the other CCOs in the Portland metro area, because there's several there. So that's sort of what that health share part was referring to. So other sort of things, you could view or print a member ID card by clicking here. You would enter first and last name, birthday, and then it would give you sort of a screenshot of the ID card. So you could then print that out as a temporary ID card if needed. Another way to always have access to your member ID card is to download our app. I wouldn't say it's the best app. It doesn't have a ton of features. It's sort of the chicken before the egg. We ask for more features on the app and they say no one uses it. And then we say, well, people don't use the app because it doesn't have anything helpful, but they don't want to really build the app if people aren't going to use it. So this is year 3 of that conversation. So we'll keep trying, but the free app does have a copy of your member ID card. So it is kind of handy. You can download the member handbook in both English and Spanish. And they talked about InTouch a little bit in the video. So InTouch is something that our members would have to sign up for. So you create a user ID and password, but then it would have information specific to the member on that page. So you could look and see, I don't know, prescriptions, for example, or your primary care provider. You could see maybe if you had something ordered like a MRI or some other type of imaging, you'd be able to look there to see where it was at in the process of being approved or denied. Another sort of interesting feature is a chat function. So you could log into InTouch and actually chat with one of our customer service representatives through the website instead of having to call, which I know is appealing to some people who maybe prefer to not make a phone call, or maybe it's hard to make a phone call because they're hard of hearing or another reason. So we are encouraging people to sign up for InTouch if those features sound appealing. And if you need any help with that, you're welcome to reach out to me and I can connect you with the right person that can provide some technical assistance. And if it's something that the CAC would like to see sort of a demo of, I could ask the staff for more time at a future meeting and have somebody come in and actually show how InTouch works, like with a demo member. But I was just going to pause real quick to see if anybody has any questions about that feature, because it is new to our Community Solutions website.
Kristen, I have a quick question. Sorry.
Sure.
Oftentimes I deal with like families that their OHP cards don't have the correct last name, or because when they're filling out the paperwork, sometimes they accidentally put where the middle name would be, like one of their last names, even if they have like two last names. How, what would they just like call to request a new card with the correct last name, or is it something that like I could help them online to do, or emailing? What would work best?
That I might have to follow up on. I
Okay.
think it could just be changing names and legal information like that might all still have to go through the Oregon Health Authority.
Mm.
I'm not sure if Dustin or Caroline are on and if they might have more information about that, but I think that those types of changes are made at a state level and then they provide that information to us. But let me see if Caroline or Dustin are on the call and if they know. If not, I will follow up.
Okay. Thank you so much, Kristen.
You're welcome.
I missed the detailed part there.
Do you know, Dustin, if a member or a community partner can change, like the example given was when the application is filled out, maybe the first name and middle name get mixed up, or middle name and last name got mixed up when the member ID card is ultimately printed. Do you know if all, I'm just going to use the term demographic, but sort of demographic changes like that, like a name change, would go through the state?
Yes.
Okay.
Yeah, because that's the state system. That would be in the MMIS system there. So yeah.
Okay. But I can still try to follow up with the easiest way to provide that change. So you're not on hold for a half an hour.
Yeah, the member portal should be able to take some changes. I think what could get confusing there is if the name is registered wrong and then calling in to try and fix it on the member portal, going in incorrectly and then trying to change the name. So I'd have to research if there's a better way to do it, but I think the member portal, you're able to make those changes too, just like other demographic information like address.
So we'll both do a little bit of research there and we will follow up with you. We'll circle back on that.
Thank you guys so much.
You're welcome. So if there wasn't any other questions, I'll kind of continue to move through this because now we are down to 10 minutes. So there's all kinds of things. You can download forms here. So some of the forms that you would find on CP is community partner. So you would be able to find some things that I think are kind of helpful here, like a flex fund request. So if you wanted to ask for something that's not covered by Oregon Health Plan, maybe you have a kiddo that's really wanting to try playing a sport this year, and you'd submit a flex fund request to our team to pay for the membership fees and maybe for the uniform costs. You can access those forms to make that request both in English and Spanish. Well, it's here, sorry, here. There's also more information about how to locate an interpreter, something that has come up kind of more recently. And here's sort of a 1 or 2 page flyer that has some information on how to get an interpreter. And you can also print like I speak cards. So there'd be a card that somebody could print out that says, you know, I speak Spanish, or, you know, something like that. So when they went to maybe they go to the emergency room even, and they're at that front desk to check in, and they could present that card, and then that facility could find an interpreter to help that member navigate the service that they needed. So something that actually Brad reached out to us about fairly recently was how to find a provider that speaks Spanish was the example that he gave. And so we've kind of like done some internal discussions around that and realized that currently the provider search tool is not very helpful in that way, because our providers have to provide interpreter services. So they're all going to show that they're Spanish speaking, but that is not the same as having Spanish speaking front desk staff or Spanish speaking MA to help somebody check in and things like that. So that's actually work that's ongoing currently. We have a whole group of provider service representatives that are currently collecting demographic information from our providers, which includes their race, ethnicity, language spoken, and their sexual orientation and gender identity. Of course, just like our members, they always have the ability to opt out of providing that information if they don't want to, but that is something that we're actively collecting. And at some point, we hope that our provider search tool will be able to be filtered by those different fields. I'm not sure how that would look with maybe, I'm not exactly sure how that'll look. But that work is ongoing and it's definitely on the top of our mind. I actually saw, we're calling it an asset map recently about mental health providers that are providing care for youth or for young kids 0 to 5, and saw sort of a piece of how that information is being collected. So more to come on that. But I just again wanted to stress that any provider accepting OHP, Medicaid, has to provide interpreter services. It doesn't necessarily mean it has to be in person, but if we ever have providers not offering that, including making appointments, so I'll be following up on that, please let us know. It's just going to take a pause if anybody had a comment or anything to say. Okay. So I was just going to show something that I was actually looking at earlier today. I'm going to just put in Redmond zip code because I kind of think it's the middle of the area. And so I would sort by community solutions. But what I thought was kind of interesting was now we have our traditional health workers listed. So I would do search. And we have 63 state certified community or traditional health workers now in Central Oregon, which is great. And yeah, I just noticed that that was today available, last updated even today. And so if you ever are seeking a community health worker or peer support specialist, you can now look for them through our provider search tool. Okay. Another thing I was going to point out, so again, you can look for a pharmacy. That's going to be the same search tool. Oops. Whoops. You can search on this Find a Provider page. You'll see that there's a doctor, dentist, pharmacy. You can print a directory or find a ride here. So Lane County uses a different non-emergency medical transportation provider than Motive Care. So, and each Motive Care region has a specific number and things like that. So you can kind of toggle through to search the provider directory by those different categories. As far as pharmacies go, it's also worth noting that we do mail order pharmacy through CVS. So I know that we've had discussions around that before. And one of the concerns that one of our more rural members brought up at one point was just mail delivery not being timely, or maybe mail even being stolen. But I always like to remind people that do feel confident with their mail service that if getting to a pharmacy is hard or not how you want to spend your time, that you can have your prescriptions mailed to your home. And I know we're running out of time, but I did want to also just note that when you go to others who can help you get care, that is an area where you could find information on all of the different types of providers, transportation. Let's see. Oh, shoot. I thought that was also where grievance and appeals was. Oh, you can also file a grievance or appeal through the InTouch portal. So that was another sort of nice thing to note. Here we go. Complaints and appeals under your plan. And you guys saw this video beginning of last year, a year ago, actually, at our CAC. But the grievance and appeal video is online. I don't have 5 minutes to show it to you now, but it's there. And again, you can file an appeal online through InTouch or call, or you can download the form, mail, fax. But with my last minute, I'm hoping I can ask if anybody has any questions. If you have feedback or a chance to spend some time on the website, and if you see things that are incorrect or not working or not clear, please let me know. Our marketing team is still, tweaking things to make them more user-friendly or correct.
Thanks, Kristen. Does anybody have any comments or questions, observations?
Oh, thanks, Stacy.
Cool. Well, thanks, Kristen. Looks like it's getting better and better, so that's important.
Yeah, it's an improvement, but yeah, any suggestions we're always willing to take and pass that along to our marketing team.
I had a real quick question. Dustin, you mentioned a member portal. Were you referring to InTouch or were you referring to some other member portal?
The one system.
The one system. Okay, so not a consumer access. I mean, consumers can't access that unless they're working with a certified sister or something, right?
No, they can access it without a sisters.
Oh, can they?
Yeah.
Okay.
Yep.
Guess I should know that.
Well, you do now, and that's
I do now.
Right.
All right. Well, thank you, everybody. We'll let everybody go on time. Happy New Year, Feliz Año Nuevo. And thanks for all your work. We'll see you in February, if not before.
Nice to see everyone.
Thank you. Bye-bye.